Aloha, this is Corinne Jp. I'm an undergraduate student studying in Bachelor of Social Work, and this is my capstone presentation, Geriatric Clients' Needs and the Agencies that Support Them. Who Needs Boundaries? My research was to understand the needs of the older adult in our kapuna, a 501c3 organization that assists the senior population in Hawaii, and how it taught me a hard lesson in awareness of boundaries as a helping professional. Professional boundaries may enrich or hurt the working professional's relationship with clients, colleagues, or administrators. According to the National Association of Social Worker Code of Ethics, social workers should be aware of the impact on ethical decision-making of their clients and their own personal values and cultural and religious belief practices. They should be aware of any conflicts between personal and professional values and deal with them responsibly. As a volunteer with our kapuna and the challenges I had endured with a 70-year older adult, I realized that I was spending much energy and time on this one client, thinking I was projecting empathy, compassion, and cultural awareness. I gained his trust, thereby developing a working client relationship. The NASW Code of Ethics adds that social workers should demonstrate awareness and cultural humility by engaging in critical self-reflection, understanding their own bias, and engaging in self-correction, recognizing clients as experts of their own culture. After a couple of visits, the client shared his context of change, his struggles with his family dynamic, having lived and cared for his mother, then his mother suddenly passing away. He related a sense of urgency for me to help find another home for him because he was not satisfied with the location the helping professional at the Elderly Affairs Division had placed him. I also witnessed him throwing trays of food that another agency had provided daily. Nevertheless, I respected his beliefs on purchasing special food items during his celebrated holidays. All the sudden changes impacted this client's social system. Our kapuna directors supported me in capacity building with the client to set boundaries to the limits that allow for a safe connection based on the client's needs. As an advocate for change who was aware and understood the person in his environment, who was I to deny his weekly packs of cigarettes and everything cookie from his favorite store? What was the harm? These specific items were his necessities to add joy in his life. He was the one paying for the items. He possibly worked all his life, and now the only stability he had at that point was his monthly paycheck, which he had control. Capel states, regardless of whether the boundary may be shifted or not, it is necessary for it to serve its purpose, which is to protect one's dignity and ultimately one's human rights. A qualitative interview was conducted with 5 helping professionals who found that setting boundaries for themselves and their mental health was very important, with an average score of 9.08, including setting boundaries with older adults, the agency, and a helping professional. The scaled average of 7.7 indicated that setting boundaries were not as easy to do as a professional with the agency, staff, or the older adult. Each helping professional had a personal or professional experience that tested the boundaries with the older adult. One professional maintained boundaries by listening to the older adult, creating empathy, active listening skills, summarizing, and mirroring. Additionally, validating that professionals and the agency also have limits to the helping process. There were clear roles in my duties and responsibilities. There were no significant issues with boundaries working as an administrative practicum student. When I volunteered in person as a helping professional, I somehow unintentionally crossed the ethical boundary line with the scope of practice as a helping professional at a meso level with Our Kapuna's mission. I empathized and assisted the older adult, knowing that I could not do this for all other adults that may need assistance from Our Kapuna. On a micro level, the decisions I made unintentionally enabled the older adult to no social change. My actions impacted my reputation with the agency providing a service for the client's health and welfare, in line with the objectives at a macro level with the Department of Health during a pandemic, and the organizations that authorize contracts and grants to provide financial assistance to get all Americans healthy. The research could have benefited by obtaining the client's or older adults' perspective on setting boundaries. In conclusion, according to the National Association of Social Work Code of Ethics, when multiple relationships cannot be avoided, the helping professional, the client, and the agency have an obligation to set clear, appropriate, and culturally sensitive boundaries. Thank you for listening to my presentation. Mahalo.